Me too.
Okay, I love you so much. Okay, let's do it. If everyone's ready, and Weeky, you're ready?
I'm good. I'm ready.
Okay. Hi everybody, PoopWitchX here with episode 9 of Coven Conversations. And today I have with me the beautiful, amazing, talented, and sweet WheekyPotato, where we are going to be talking about healthcare and more specifically issues that arise within healthcare. Thank you so much for being here, Weeky. How are you doing?
I'm doing great.
So first off, I've been wanting to ask you this question since you sent in that you want to do a podcast with me. What made you want to pick this topic in particular?
So I've gone through a bunch of stuff in terms of my medical history since I was probably about 16. I've had a lot of issues. Minus dental work, I've had about 5 different procedures done.
Wow.
I've had my appendix removed. I had knee
Same.
surgery. I had the screws removed from my knee about 6 months after that. I had an endometrial ablation and I had a hysterectomy.
Wow. Okay. And
And
do you
I'm
mind me?
recently 25,
I
so
was just
it's
about
been
to
a long
ask
time.
you, just as a reference point. So you just turned 25, you said.
Yes.
Okay, so for anyone who may not be as how do I put this? Well versed in healthcare, having that many procedures before 25 is highly unusual, but also quite incredible for you to have gone through all of that at a young age and having to endure all of that. So you should be really proud of yourself because I had only my appendix taken out and I was basically traumatized. So I commend you for wanting to talk about this and share your story. So one of the things, what was your first experience like? How old were you when the first time you had to go in for a procedure was?
I was 16. It happened Labor Day weekend is when I
Wow.
ended up having to go in for my appendix removal. Initially, I had pain in July and it hadn't localized yet. It was kind
Mm-hmm.
of all over the place. It was kind of on like my upper right side. It was in my stomach area, but it wasn't towards the lower right quadrant where they're like,
It
oh, it's for
usually
sure
is.
the
Yeah.
appendix. Yeah,
Interesting.
and this had happened during the summer. So we ended up going to the ER and they looked basically everywhere where the pain was and they did an ultrasound. They found nothing and they gave me morphine for the pain before they sent me away. And I got so high as a kite.
They gave you
Um,
morphine at
yeah, they gave me
16.
morphine. Yeah. And
Okay,
what
that's
was
already
really
a red flag to me. I mean, I understand if you're in pain, but morphine is hardcore. I mean,
yeah,
holy moly. Okay.
yeah, it was crazy. And what was even more insane was the fact that they gave it to me. They didn't have a bed in the ER at the time, so I couldn't sit and lay in a bed at all. And so I was sitting in the hallway in the back of the ER, um, right down the hall from one of the nurses' offices. And so my mom was sitting next to me. I was laying down, and like because of the morphine, like I couldn't hold myself up. I couldn't sit upright. And so I was like this on the back of the
Oh
chair
my
with my
God.
head down. Like my entire body felt so heavy. Like I couldn't lift anything.
Yeah.
And I was like laughing at anything and everything. Like
Wow.
the stupidest thing, I was like laughing nonstop. Both the nurse and my mom got sick of it. But
Well, I
that was
mean,
my
wow. At
yeah, so that
16
was my
though.
first experience in the ER and then not finding anything. And then a few months later, going in Labor Day weekend, and they're like, oh, it must be the appendix because after the ER visit, after the morphine wore off, the pain had localized into my lower right quadrant.
Yeah, so that's
And
how it
so,
usually presents itself. So it's unusual, and also it's highly unusual that you had symptoms for that long. You're very lucky, and honestly,
mhm,
they're lucky because they technically misdiagnosed you when you first came in, and that you didn't have your appendix rupture. Because the thing about your appendix is, appendicitis is incredibly common, but what makes it so dangerous is it's not a big deal procedure to have. Did you have like a laparoscopic where they just kind of made okay? So laparoscopic is when they make very small incisions. They put a little sort of like pull in to inflate your stomach with gas so that they have room. They put a camera in and a little sucking mechanism, and they slurp it on out, basically, in, blunt terms. But so it's not a huge surgery, but the thing that they're always fearful of is they don't want your appendix to burst because you can get very sick. So I'm really, first of all, I'm also kind of shocked that they gave a 16-year-old such a powerful opioid. Morphine they give to people who just had like an appendage removed, like their arm. They give soldiers who come back from battle. I mean, it's a hardcore drug. So, do you feel like your age was sort of a factor in maybe them not taking it as seriously?
I definitely do, but I also think that I was misdiagnosed with the appendicitis as well,
Mm-hmm.
because when they did the surgery, because it was in the lower right quadrant, they just
Mm-hmm.
assumed, oh, it's got to be the appendix.
Yeah.
So they went ahead and removed it. When they did, and they went to go talk to my parents after the surgery was over, they were like, well, it wasn't quite on its way, but they were just like, oh, we'll just say it was chronic appendicitis. So it wasn't ready to burst, but it could have been going.
Oh
So they were
boy.
misdiagnosing it already before when I had the appendix done,
Wow.
because I'm pretty sure that that was the start of when I was having issues with my uterus. And I feel like it was probably an issue with one of my fallopian tubes.
Oh.
Um, and so I think that's why I was having pain, but they just assumed lower right quadrant, oh, it has to be the appendix.
Right, right. Wow. Okay, and also I feel like it's, first of all, it's really frustrating to hear this because I feel like, you're a 16-year-old. It's very hard to advocate for yourself when you're 16. Like, it doesn't matter how outspoken you are. Most physicians, whether you're a PA, a doctor, or even nurses, they sometimes will write off when you're young. You're young, you're fine. You're young, you're fine. And then you have the addition of you're a woman, and unfortunately, or a young woman at the time. Unfortunately, that's another thing that happens, is that it's like, oh, you're making a big deal out of it. Oh, it's just cramps. But actually, in preparation for today, I was doing some research, and there are studies coming out that actually say that cramps can be as painful as a heart attack. So it's sort of interesting that all of this with just your appendix, which again is something I experienced as well, happened at such a young age, and it was possibly a misdiagnosis, which is really, so how long after that happened did the whole, you had endometriosis, right?
No, I didn't.
Oh, okay. What
Um,
okay.
Yeah, I never got an official diagnosis about what was going on, actually, which is kind of frustrating,
Okay.
that I still don't know what exactly it was. I will say that my theory, anyway, is that um, because on top of all this stuff, I've had issues with my period, because I think that was the main issue with the appendix and leading into eventually getting the
Mm-hmm.
hysterectomy, that all of this was because of my uterus, that I've been having all these issues.
Mm-hmm.
Um, because I started having my period at 11.
Wow.
Um,
Holy moly, that's
I,
really young.
yeah, and I never regulated. My mom, she was always like clockwork every month, on time. She had her period. Mine was never consistent. So I would have mine every month and a half to 2 months. And then it was starting to get longer, where it'd be like 2 to 3 months. And we went
Wow.
to the doctor, and the doctors were like, oh, yeah, no, you're young. It'll figure itself out. You're
Right.
fine. Nothing to worry about.
Mm-hmm.
And it never regulated. In fact, it just kept getting increasing first.
Mm-hmm.
And so they tried putting me on birth control, and I didn't feel good on it. So I
Yeah.
stopped taking it,
Mm-hmm.
and just gave up on that route for a while. They did tests on me to see if maybe I had polycystic ovarian syndrome. And because my blood work was within the normal range, then they decided, okay, well, then you don't have polycystic ovarian syndrome. And they did an ultrasound. They're like, well, you don't have endometriosis either. So they were just like, well, you're fine. You're just crazy. You don't know what you're talking about. You're young. Your body will figure itself out. You're fine.
Oh, it's so frustrating.
Yeah.
Wow.
And I kept going around and around and around, kept trying to talk to different doctors, and they all kept saying the same thing.
Yeah. Wow.
Um,
So what okay, so the appendicitis, you think it was probably not maybe appendicitis and just something, it was something else. Like you said, it could be your fallopian tubes or something like that. Do you
yeah.
feel like do you feel like that sort of whole thing that transpired with the appendicitis, was that like the first sort of part of your journey?
Yeah, definitely. That was part of the first part of my journey towards
Okay.
eventually getting down the road to finally getting hysterectomy. Um, when after the appendix was removed and I was recovering from surgery, I still had the pain on my lower right side.
Hmm.
And they told me, oh, that's just scar tissue and it'll
That is
heal
not true.
eventually and
Yeah.
it'll go away. And the pain never went away. I still had that pain in the lower right quadrant. And there were times where it would just get really bad and it was like these sharp, searing pains.
Hmm.
Eventually, once I started driving, sometimes I would get those pains and it would hurt to sit there in the car trying to
Oh.
drive or like at a stoplight and the pain would come on and then I'm just trying to live my life and that pain
Yeah.
kept coming on.
And there's an expectation that, especially when it's in that area and people are just like, oh, it's cramps or whatever, people are like, you're just supposed to move on with your life. You're supposed to go do your job and be a parent or be a teacher or be, and sometimes the pain can be so debilitating. It's like, I think there's a misconception that we're, as women, this is just our thing that we have to deal with. But it ranges in severity. I mean, it can be crippling. It sounds like that's what you experience, like almost like a crippling, debilitating sort of feeling. So you got your appendix taken out. How long after that experience was like the next phase of your story?
The next phase, I believe I was 19, 20 when I was trying to go through the routes again of trying to get them to basically do a hysterectomy. I'd been wanting one since I was about like 17, just
Yeah.
because I was so frustrated with the pain that I was having,
Mm-hmm.
just like with having problems with my periods because they were every 3, 6, 9 months apart. And they would
But
be
were
super
you still
light. So
having the
that's not
pain
normal.
between the
Oh yeah, I
periods?
was
Oh,
having
okay.
normal. I was having really bad cramps. I was just absolutely miserable.
Like through, so
And
basically, it doesn't matter if you had your period or if it was the time between your periods. You were just always in pain.
yeah, I was just miserable, whether it was like the lower like quadrant that was in pain, whether it
Mm-hmm.
was cramps, PMS, and my mental health was not okay.
Mm-hmm.
I had no patience whatsoever.
I can imagine.
Just the smallest thing could just trigger me, and I would snap at my parents or I would
Oh,
snap at anybody. I was just always on edge. I was just
chronic pain.
angry and frustrated. Yeah,
Mm-hmm.
it's the chronic pain.
Mm-hmm.
And then being told I'm crazy, don't know what I'm talking about. I don't know my own body.
Mm-hmm.
Um, and just being cast aside like it doesn't matter.
Right.
So that was just really frustrating.
It's terrible.
And so when I went to the doctors again, and I had to see multiple doctors, and they were like, well, we can't do a hysterectomy. That is the most extreme thing. You're also young. Oh, you definitely want children. You're just saying
I
that.
was
You're
gonna
going to change
ask you
your
about that. Yeah,
mind.
yeah, yeah,
And so they're trying to push of like, you're going to want children. Even
yeah.
though I've adamantly said since I was young, and my mom, even when she went with me to the doctors, and she even said, I've always been adamant about not wanting children.
Mm-hmm.
And if I change my mind, I would adopt anyway
Right.
because my fear is like having like an alien baby just
Yeah.
growing inside of me, just like the seeing an alien was just
Weird
like, bleh.
feeling. Yeah, very
So
weird.
I was just like, no, 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 I don't want
Yeah,
kids. And if I do, adoption. And they didn't want to hear that.
of course.
They were
Yeah.
still like, oh, no, you're just going to change your mind. You're going to want your own kids. You're not going to want to adopt.
Mm-hmm.
And that was also frustrating to hear. But they were like, well, we can't do anything. We have to go from the lowest point and work our way up to get to that point before we even consider doing a hysterectomy. So all of this time, while this was happening, I was under Kaiser Permanente's care. Um, and so they were like, well, you're going to have to try different birth controls first. So we started with the pills. That didn't work because it raised my liver levels significantly. It
Oh
was,
wow.
um, it was kind of, it was in the hundreds, borderline 200s.
Wow.
So I had to stop that and try the Depo-Provera shot. I was the first shot I had because it had been so long since I had a period. It was purging everything in my body, and I felt
Mm.
like I was giving birth. I was in so much
Oh
pain.
my god.
My body was contracting
Acting.
so much,
Mm-hmm.
getting rid of everything in there, just sloughing off
Mm-hmm.
everything. And I was crying. I wanted to scream. I was in so much pain. And when I had called Kaiser Advice to tell them that, and they're like, well, what's your pain level? And I said 11. And they're like, well, how much is your bleeding? And it wasn't enough. They in their mind, I wasn't bleeding enough to warrant to go to the ER and get help and pain medication
Jeez.
to deal with this because I felt like I was giving birth. It felt like I wanted to die. I was in so much pain.
My God.
And then the second shot that I had, that's when I started getting migraines, very severe migraines. So then they were like, well, we have to stop this immediately. And they put me on migraine medication and a steroid to get it out of my system. And then the next option, they ended up doing an IUD, and that worked for a while, but it failed after a few months because it turned out that I think it was the Mirena IUD has the exact same hormone as the Depo-Provera shot, but at a smaller dose. And so it was building up in my body long enough, so I was starting to have migraines again.
Oh, man.
And so I ended up having to go. That was the point when they were like, okay, then we'll go ahead and do an endometrial ablation.
Okay.
So what I went in, which if anybody in the future, they ever have to go in to get an endometrial ablation, I highly, highly recommend you have them put you under because they did not put me under for this procedure. They sedated me. And what they do is they put a balloon in your uterus and they fill it with boiling water. And I was being boiled alive. I was in so much pain. They had me on pain medication, they had me on sedation, but I felt everything. The pain was excrucicating. I was off
I'm
for
sorry.
days
I just have
afterward.
a question. How old were you when this was? Well, it doesn't even matter. Did they give you, I'm sorry. That's surgery, basically. I mean, that's like, I mean, it's not invasive surgery, but the fact that you were conscious while they were doing that seems like medical negligence. I don't know how they would not. I completely agree. I don't know how I'm like so upset about what you just said. I just don't know how, because I know what an endometrial ablation is. And I'm sitting here and I'm like starting to like twitch. I'm like, what is she talking about that they did not put her under? That is an extremely painful procedure that they have to do. I have a couple of questions.
I was 22.
Okay, you could be 102. It should never have happened. I'm just like losing my mind. Okay, I have a couple of questions. Just, okay. First thing was, it doesn't really matter, but just out of curiosity, were the doctors you seeing men or women or both? Were you seeing different doctors, or just were you going back to the one?
So I was seeing women doctors majority of the time.
Okay.
I finally got the approval for the endometrial ablation from a male doctor.
Okay. Is he the one who did the procedure too?
No.
Okay.
I had a female doctor perform the procedure.
Okay.
But it took for me to see a male doctor, which was really surprising to me, to finally be like, okay, you've been through all this. Yeah, you can have the ablation.
You know what? And that's actually one of the things I wanted to touch upon, is that when it comes to the medical field, there's sometimes women or men have a preference if they see a male doctor versus a female doctor. But medical professionals go through many, many years of schooling, and there's a certain point where they stop being, I'm going to go see a male doctor, female doctor. They're really just doctors, and they all feel like they know your body better than you. They all say they write off things because you're young. They write off, even female doctors will write off female patients' pain and say, I'm a woman, I know, or I've seen 100 women give birth. You shouldn't be screaming like this. I literally watched a documentary today in preparation for today where that actually happened. So I think there's a misconception that I think sometimes male doctors can be more sympathetic and female doctors. So that, putting that to the side. But then one of the other things before, because I feel like you said a lot of important things that I wanted to make sure. You needed approval to get the hysterectomy, which is the removal of your uterus, right? Because they said...
Oh, well, first
No,
I had to
continue.
get permission for the endometrial ablation.
Right.
And I had to sign my life away. I went in before the procedure to the doctor to talk with the doctor before the procedure, and then a nurse had to come into the room, and she had to sign as a witness to say that I agreed to this procedure, which I've never had that for any other procedure before. But because it involved the fact that they were like, well, because you're having this procedure, you have to sign this to agree to the fact that you're not going to have children because it's not safe.
Right. And I think one of the things that I also want to just like touch upon is that what went through, and we haven't even, finished the journey, but like I just want people to understand that this is somebody who's in chronic pain, and you tried how many different birth controls?
I tried, I think, at least 2 different pills, and then I had the Depo and the Mirena IUD. So that was about 4 different birth
Which,
controls.
just alone, by the way, an IUD can be extremely painful to be implanted. I mean, I know. Yeah.
I had to be sedated for that. That was the procedure itself. Like I had to be sedated to get it done.
So you right now are somebody who's been experiencing chronic pain and issues with you're basically with your menstrual cycle since you were 11, and you've been in chronic pain. The doctor's like, we're going to try putting you on all these different pills and giving you a shot and an IUD. And IUDs alone can be incredibly, I mean, an IUD, if put in incorrectly, can perforate through your uterus. I mean, these are no joke. So for anybody who is maybe not as well versed or is trying to learn or understand what some women have to go through to have body autonomy, to not be in pain, to get control over their menstrual cycle, I mean, this is incredible. This is terrifying and upsetting, and I am so sorry that you went through all this. But okay, so you've tried all these medicines. Now you're at the endometrial ablation, and they didn't even put you under. Your mom sounds like she's an advocate for you. Did your mom kind of be with you every step of the way? Is she somebody you can rely on like that?
Yes, she is. And she tried really hard to try and push for adequacy for me. There were a few instances where one of the doctors had crossed the line, and so she took me straight to patient services and was saying that this is unacceptable, the way that she was treated. This is like completely wrong. Like, because with the IUD, they initially wanted to do without sedation, which I could not handle that at
Holy
all.
moly.
And so, like, I assumed that I was going to be sedated beforehand, and I had prepped an assumption for that.
Do you
and
mean when you say sedated, do you mean like going under anesthesia?
No, not anesthesia, just being like sedated, like relaxed, so that way I could handle it. Right. And they had no plans for that whatsoever. They were going to try and do it without any type of sedation, and they were just going to be like, "This is happening today," and then goodbye. Wow. And I couldn't put up with it. I couldn't put up with the scope, and so my mom was furious. I was upset. So I'm getting
like heated. My hands are like, I have fists up right now. I'm so, first of all, yes, mama. Like, I'm so happy that you had somebody in your corner fighting for you, because I mean, you sometimes really, honestly, like, this is a real thing. Like, no, it's not just women. I feel like younger adults are always at the mercy of older, more wise people who, have studied, and they don't listen. And I'm so glad that your mom was an advocate for you, because can you imagine if maybe you didn't have her, and like, what would have happened? Like, it's so scary. And I'm so glad that she was an advocate for you.
Honestly, don't know. A lot of times, even with her being my advocate, most of the time it didn't feel like it even mattered that she was there. Because they still didn't want to listen. They were just looking at the fact and looking at my age. They were just thinking about statistics and medical books, and not thinking about the person or the possibility that, hey, my body doesn't fit the structure of a textbook.
Right.
So my case is not what you consider the norm, and you're not willing to try and figure this out with me, because what I'm experiencing clearly isn't normal, because you haven't seen it before. And of course, it's new to me, so how would I know?
And you're the one enduring it.
Yeah, and I'm the one enduring it, and they don't want to listen to what I'm having to deal with on a daily basis. They don't care. And it's really frustrating.
And I think also, even more than just frustrating, it's kind of painful to have people who are, you're supposed to, our society looks at doctors as saviors, and you have all these doctors and specialists, and they're not listening to you, and they're just, oh, I haven't seen this before, so you don't fit into this category, and they're nullifying your pain in a way. And by doing so, they're putting not just people like you, but people with all different types of medical health concerns at risk for things getting shoveled under. How many people who maybe have no understanding of things in the medical field, and they have a lump, let's say they have something, and they're like, the doctor's like, oh, that, or a freckle or something or whatever, and they're like, oh, this is bothering me, and that doctor's like, oh no, it's fine, and then they're like, no, and how much you have to fight. And it sounds like, you really had to fight for yourself. So you had the endometrial ablation, and then what happened? Or what happened afterwards?
So before they went in to do the ablation, while there for the procedure, they did a hysteroscopy, and so they took a camera and they looked through my uterus to see if they could find anything, whether it was a polyp or a cyst or anything like that, and they claimed that they didn't find anything. Okay. And so again, that was just another piece of just like, well, why is this happening if there's apparently nothing wrong with me?
Right.
And then of course having the procedure done. So after having the ablation done, that was the end of my journey with Kaiser. I got a job, and a full-time job, and
when you say Kaiser, I don't know, is that like a program or?
So Kaiser Permanente is an insurance option.
Okay.
It's mostly in Northern California. There are a few locations in Oregon and Washington, Hawaii, a few other states, but mostly on the West Coast in California.
Okay, because I hadn't heard of it, so I was like, I don't know if that's like a program. Like, it was like, is it a hospital? Okay,
it is a hospital because Kaiser Insurance, it's run for their Kaiser hospitals. So when you use Kaiser Insurance, you have to use it at a Kaiser hospital.
Okay.
And so it's all encompassed into
its in-house
entity.
Okay, it's an in-house medical. Okay, interesting. So,
it's almost like public medicine, the concept of public medicine, except it's private, but it's all internal. And so they're always looking for doing the least amount that they can.
Right.
Because all of the costs are internal. Yeah.
Right.
Keep the costs low. And so that's why everything they do is extremely conservative approach before they go up in the steps. So
do you feel like that contributed to maybe them not trying as many things or looking into as many things because their bottom line was a factor for it?
Yes.
Okay.
And so I was fortunate enough to be under Kaiser, but also it was kind of a problem being under Kaiser because my dad worked for the government for about 26 years, or actually, sorry, 40 years, but 26 for the same city. And so because of his medical plan, it was very reasonably priced for me to go to the doctor on such a regular basis as I did, and get all of this stuff taken care of. And so for me, it was cost effective. For a lot of other people, that's probably not the case. Because this type of plan that we had, or I had when I was with my parents, it's very cheap and very affordable. And for as expensive as those procedures can get, I don't know what it would be like, how much medical debt people would be in if they had to go through what I did.
Right. Of course. Yeah, I can't. I mean, yeah, definitely. It sounds like it would have been. And that's also an issue when you have insurance companies that do, and I worked I had to do insurance for a medical company for a while, and unfortunately, when you do have insurance companies dictating how much that the doctors get paid and how much procedures are, and it's all about the bottom line, it does become a very problematic system because insurance companies are only going to pay so much. Some doctors do want to do as much as they can, and the insurance companies are like, no. So then they have to go, hey, patient, you're suffering. Can you afford to now pay out of pocket for this? And the patient's like, no. And the doctor's like, well, now what do I do? So it is a really complicated issue for many people in this country. And I'm glad that you at least had the opportunity to go to the doctor frequently, but it does still sound like they maybe didn't do as much as they should have.
Yeah.
The last procedure you had with them was the endometrial ablation.
Yes. And
Okay.
then I got my first full-time job, which I still have, and I went under their healthcare. So I was no longer under my parents. I went with their health program. And so that was with Blue Anthem Cross.
Okay.
And our main provider for our medical care to have so I'm lucky enough where I don't have to pay any premiums. And if I go to Stanford Hospital, then our insurance covers 90% of whatever I get done.
That's good.
Yeah.
That's good insurance. Yeah. So you
And
have a 90-10 split. So you do
yes.
10%. Do you have a deductible or an out of pocket?
Yes, there is
Okay.
a deductible. I forget what it is, but it's not
Yeah.
too bad.
Yeah. 90-10 splits are good, guys. Those are good.
90's really good.
Yeah.
And so at 8 months after the ablation, it failed. Because
wow.
the whole point of having the ablation was to burn the lining of my uterus completely. And so then I'm not supposed to have a period anymore. Or if I do, it's supposed to be extremely light, not painful in any way. It's supposed to get rid of it. It's almost like having a hysterectomy, but not quite.
Yeah. It's the halfway point.
It's the halfway point.
Right.
So it failed after 8 months, and I
Only
was
8
miserable
months.
again.
Wow.
Yeah. And I was bleeding nonstop.
Wow.
Because before I had the ablation done, I was bleeding nonstop.
Wow.
And that's why they went with the resort of doing the ablation finally, was because I was bleeding so much. They were shocked that I wasn't anemic with how much I was bleeding.
Yeah.
Both the time I had the ablation done and the hysterectomy, they were shocked I wasn't anemic.
Do you eat a lot of red meat?
No, I eat more chicken than anything.
I'm just because coming from somebody who's anemic, I'm like, tell me your secrets, please.
Yeah,
it's pretty impressive.
I just got lucky in that department.
Yeah.
But yeah, so I went to our health and wellness center at work, and the doctor referred me to Stanford, and I got a call from them, and I got lucky. They booked me with the head of the department in gynecology at Stanford. And so I saw her, and she was the first doctor I saw that actually listened to me. And she went over my entire medical history. She was looking through my charts, and she was also listening to my story and hearing what happened to me and everything that's gone on. And at the end of everything, she looked at me and said, okay, what do you want to do?
That's great.
This is your choice. What do you want to do? And I said, I want a hysterectomy. And she said, okay, we're going to do it.
Yes. Good for her to be a doctor that cares, because my father's a doctor, and he came from the world of, it was just him and his partner, and they saw one patient at a time. They knew their patient's name, their dogs. They got to spend, an hour with each patient, and there was this familiarity that you develop. And he retired at the peak of the conglomerates taking over, and doctors have no time to read your chart. They just skim it. There's it's like a numbers game. How many patients can you see in a day? Because it's so dictated by insurance. I mean, my dad's office only accepted like 5 insurances. So it sounds like she had that sort of feeling with you. Like, I'm going to listen, and I'm going to take the time to understand this person and to help this person. And those doctors are unfortunately, forced into, a lot of doctors now are forced into that role of like, get in, get out, get in, get out. And, chart as much as you can, bill it to the insurance, move on to the next one. So it sounds like you found a doctor who really cared, which is amazing, which is fantastic. So she said, what do you want to do? And you said, I want a hysterectomy. And what happened? Obviously, you had one, but after that.
So hysterectomies are a little tricky in terms of insurance. You can't just go around and get it and expect for your insurance to pay for it.
Right.
If you're going to have one, at least for my insurance, it had to be deemed medically necessary for them to cover the 90%.
It's very common, yeah.
Yeah, and so fortunately they did. I made sure that the doctor knew that I needed for it to state on whatever paper it was that it needed to be medically necessary for me, because otherwise my insurance wouldn't cover it.
Right. The
And
doctor
so,
submitted to your insurance saying, I say this is medically necessary and vouching for you. And that's how the insurance company will corroborate that this isn't like a superfluous kind of choice, or it's
yes.
something that you needed.
And I think about a week for the procedure, I got paperwork from Blue Anthem stating that, yes, your surgery was approved on their end.
Wow. Was that
Um,
like a really joyous moment for you?
yes, it was definitely a relief because, and that I kept thinking, okay, they for sure have to pay for the 90%, but there's always that what if they decide to reject it?
Right.
Especially because I'm so young, they probably
Right.
think you're 23.
Right.
Why are you getting this now?
Right.
Thankfully, they approved it. And the nice thing too with Stanford is that because I was under the threshold for their financial assistance, they covered the other 10%. So I didn't pay anything for my surgery.
Oh, wow. That's incredible.
And the retail price for my surgery was $198,000.
Barf. Oh no. Okay. That's terrible. That is insane.
Yeah.
Holy moly. Yeah. Can you imagine getting hit with that bill? That would be horrifying. Yeah. Especially after you have major surgery. Okay. So you got approved, and this was the same doctor who was going to perform the actual surgery, or was she going to refer
Yes.
you to another? Okay. So you really felt like you were covered now. You had a doctor who listened to you, who really was on your side, and basically another advocate. Your insurance was on board. So how long did they make you wait until you can get it?
I think it was about, so I went in January to talk to the doctor. I had my consultation, and then at the end of May is when I had the surgery done.
Wow.
And the only reason I waited that long was because I had to wait a year after being at my work. I had to
Yeah.
wait a year before I could take the time off to recover from surgery.
America. There's just a lot of American things happening right now. Okay, so we have $198,000 surgery. You had to work a year before you could take time off. Okay, we got some stuff in the works here. Okay, so you went in, and how did the procedure go for you, and how soon after did you feel relief?
I was definitely in pain after the surgery, um, and they gave me oxycodone,
Oh,
and that was
we had 20.
not
How old were you?
helpful.
23.
I was 23.
After
Um,
morphine at 16. Oh my god, it's killing
yeah,
me.
no, that was, well, actually the pain medication I'd gotten before for my appendix, they gave me, I think, Norco, and that was not effective at all. They gave me the oxy for my knee surgery. That was also, it worked for like a couple days. It made me sleepy, but then it didn't work anymore.
Oh
And then when I
boy.
had the hysterectomy, they gave me the oxy, and again, not effective.
Wait, when you say not effective, it didn't help your pain?
No, it made me sleepy for like a couple days, but it didn't help with the pain in any way. So
Do
I
you
was
have a
just like,
very, very high pain threshold,
I do.
okay? Because
Um,
usually oxycodone or codone like knocks you, like it knocks you out. So that's pretty. So they
yeah,
gave
I
that to
have
you,
a
and it
really
still
high
didn't.
pain tolerance.
Okay, wow.
So
So
I
it
can
still
put up
wasn't
with a
effective.
lot of pain,
Yeah,
and it takes a lot to
to
get rid of
nullify
the
that
pain.
pain. Yeah.
So
Okay.
the only time I felt no pain at all was when I was recovering, as I was waking up from the hysterectomy, and they had given me fentanyl. That was the only thing where I felt zero pain.
Holy
So
smokes, Weeky. Oh
yeah,
my God. I'm not trying
and
to
of course,
laugh, but like, holy moly.
yeah,
When I got my, my pancreas, when I got my appendix out, I was in like, I had a migraine at the time, and they were like, we're going to give you 1/8 of a Dilaudid, which is a different kind of painkiller. And I was like, like I was, like they said it was 1/8 of a normal dose. And I was like, out. Like I felt like I was surfing. Like I was a mess. I was crying. I hated it. I cannot believe that fentanyl. Jesus, holy moly.
yeah. And I forget how much the dose was, but it was actually quite a bit that they had to give me before I felt no pain. Because like when I was waking up, I was like telling them I was in a lot of pain,
Oh my
and
God.
I would like rate on the scale. And of course, because my pain tolerance is totally different from what they consider normal pain tolerance.
Mm-hmm.
So I have to adjust my numbers accordingly, because if you say anything less than 7, they're not going to give you any help at all.
That is
They're
true.
just going to assume, oh, you're fine.
Yeah.
Because my idea of a 7 is totally different. Or
Right.
my idea of like a 5 is like probably somebody else's like 7,
10.
8.
Yeah. Well, that's also because you are
Yeah.
somebody who had to endure chronic pain every day. So you have to build up that tolerance. Otherwise, how would you function if you didn't? And so it was something that was sort of forced upon you. So obviously you had pain after the procedure, but did all the other symptoms that you were experiencing, did they immediately dissipate?
Oh, yeah.
Wow.
After I had my surgery, I
Yeah.
was so happy.
Oh, that's great.
The joy I felt, I
can see the
was
relief like on your face. Yeah.
I was the most peaceful person I'd ever been in my life.
Yeah.
I was very zen.
Yeah.
I had much more patience for people. I didn't get quick with anger. I was so relieved immediately after. I was just happy. I was miserably in pain, but I was happy.
Yeah.
The pain went away after like a few weeks. And then I've been living my life since. I did have some pain in my lower right quadrant for a little bit, for like a couple months or so, but I haven't had any issues since.
Okay.
It's been almost 2 years now, and I feel great. No issues.
So I can, first of all, just you talking about it, I can see the relief just like wash over you. Even just like, it's like you're reliving that experience of like, I have my body now and I can live and I can function, and it's a beautiful thing. And I actually wanted to talk to you about something that you brought up way in the beginning, because this is a really important thing that people don't know about. But when you had that pushback about about having the hysterectomy at such a young age, I don't know if people are aware of this, but not only will they say, this is something that upsets me, not only will they say you might have kids, and like, okay, in some, I can see that being, because you are young and you know you don't know if you're, but okay, you were so sure. But this is the thing that they'll also say, what if your future husband doesn't want you to have, he wants somebody with a uterus, or your future husband should have a say in that. And that to me makes me upset on a level that I could like punch the door. First of all, your future husband, if you choose to have a husband or a wife or any person in your life, should love you for whoever you are, whoever you are, with whatever you have going on, right? 1. 2, why should anyone, including a husband or a wife or whoever, have a say in how your body functions and how you can live? I mean, it wasn't just that you were like, hey, I want to get rid of this thing because I feel like it. You were in agony. This was something you desperately needed. And for that to be even a consideration, oh, your husband might want kids, which is, and by the way, I've even seen it. I watched this documentary, so I'm like, this is right on my, I was so ready for today. I was like thinking about, I watched the documentary. This woman wasn't even married yet. And the doctor said, what if your future husband, so a person she hasn't even met, like what, gets to have more of a say in her body than she gets to have in her body? And so I'm really glad that, your doctor, it sounded like this doctor from Stanford not only listened to you, but she probably did you an amazing service, because I guarantee the insurance company used that same thing. They probably were like, are you sure? She probably had to do more advocating for you because you were young. And it shouldn't matter because it's your body. And it wasn't even like you were in so much pain. This doesn't even seem like it was a choice for you. Do you feel like it was even a choice?
No.
Yeah.
I had wanted it for so long. I was like, please, I was begging for it to happen.
Oh, man.
And it was just like every doctor I had seen prior was just, no, you're too young. You can't think like that. You're going to change your mind. You're saying that now.
Right.
And after, when she did the procedure, she looked at everything inside, because there's different types of hysterectomies. So mine was almost a complete one. I still have my ovaries, so I don't have to take any hormones. Since I have my own, I'm producing my own, so I'm having no issues in that aspect. But otherwise, my fallopian tubes were removed, my uterus was removed, and my cervix was removed.
Okay.
And when they did a biopsy of everything, they also took pictures of my ovaries. And so a little bit of a clue was the fact that I have one normal ovary and a polycystic ovary. And the
Oh.
polycystic ovary is on my right side. And when they had removed my fallopian tube, I had a cyst, a good sized one.
Did
I
they
want to
not
say it
see
was
the cysts when they did the ultrasound?
apparently not. So I don't know what they were looking at, although I've seen the ultrasounds and I'm confused as to how they can tell anything from seeing an ultrasound.
Well, yeah,
But
yeah,
it
it's
looks so ridiculous.
yeah.
But
They're
it
lucky
was
that that cyst didn't burst because that can be life threatening too. So it sounds
yeah.
this when you had the okay, sorry, this might be a little personal. You do not have to answer. It was you had a vaginal ultrasound that went through into the uterus. Okay. So when they checked for that,
internal and an external.
and external. Okay. So just to get my bearings, because I'm trying to understand if you okay, because I just feel like the doctors that you saw before the Stanford doctor avoided a malpractice lawsuit from you. And I feel like they got super lucky because I'm listening to you and I have, a mild to mild amount of, medical background. And I'm still like flabbergasted that they didn't see that your ovaries were clearly different sizes, which is already a precursor to a ton of different issues that women can have. On top of it, it sounds like they might have missed a cyst, which are super dangerous for women, that you can have a cyst, they can burst, you can get very sick. So when did they do a biopsies of your uterus? Did they find scar tissue? Did they find anything going on that could explain?
So yeah, so they found the cyst in my fallopian tube, and that was probably about 1.3 or 1.5 centimeters or something.
Or on your ovary?
That was in my fallopian tube.
Oh my God. So
yeah. And
that is so painful. So there's something called an ectopic pregnancy, which is when the zygote or the little cells that are going to divide to hopefully make a child eventually, attach, instead of on the uterus, they attach to the inside the fallopian tube, and that can be super dangerous and deadly. And women have said that having an ectopic pregnancy can be worse than actually giving birth. It's so painful. So the fact that you had a cyst in your fallopian tube is excruciating, and they should be able to see that because the fallopian tubes are tiny. So if there's anything in there, it would expand the fallopian tube and you should be able to see some kind of... Okay, I'm listening, babe. I can't get over this. I cannot get over this. This sounds awful. Okay.
And then when they dissected my uterus and they found, I think it was either 1 or 2 polyps, and they were about, I think, like 1.2 or 1.3 centimeters. But apparently when they did the ultrasounds, there was nothing. When they did the hysteroscopy back before I had the ablation, there was nothing. So I'm assuming that I had to have had polyps back then. They just couldn't see them for whatever reason. And then they just boiled me alive and they were like, well, that's it. There was nothing wrong. But we did it anyway.
Yeah. As a nurse, hurts a lot, is cringing. Because honestly, it sounds like, and again, like my dad was a radiologist for women's imaging. So he does mammograms, sonograms, ultrasounds. He does vaginal ultrasounds. He does all the things that for women, right? And a lot of them he's a specialist. So people come in with complicated, I almost wish that my dad could have helped you. He's retired now, but like he deals with the things that other doctors usually don't understand. And I think he would like be punching the everything, because it just sounds like this was a complete miscarriage of all the health professionals. Like they miss things that just should not have been missed. Did they say that your uterus was tilted, inverted? Was anything like about the positioning off, or it was just they just found the polyp? I mean, they might not even have. No. I mean, it sounds like they were just looking at it like blind.
Yeah, they said that my uterus, it looked fine. Just like the structure of it and everything, it was normal. But then I had like the polyps, and then I had the cyst in my fallopian tube. And then like finding out that I have one polycystic ovary and it's on my right side. And that's where all of my pain was happening, was on my right side.
And you got tested for polycystic ovarian. Like they tested you that, right?
But it was just by blood work. And I think they might have done an ultrasound. Maybe.
Holy moly. Yeah, it sounds like
mostly it was by the blood work. And because
Wow.
it was within the normal range, they said, well, then you don't have it. Even though I had a lot of other symptoms for polycystic, they were
Yeah.
just like, no, you can't have it because your blood work doesn't show that it is. But my
Oof.
theory is the fact that because I only had one that was unusual and I had one that was normal, the normal one was compensating. And so then my blood work came back where it was within the normal range.
Holy
So
moly.
because there wasn't two polycystic ovaries, then it didn't show up on the blood work. That's the only thing I can think of as to why that happened. Because I have
I
one that's not normal.
can't think of why. I think that it sounds like there was a lot of people who, again, I think that this could all trickle back to you were young and they might have been writing off your pain and thinking that, listen, the truth is, and I hate to say this, but there's this really false narrative that plays that women are hysterical. And although many women, and I'm going to speak for women, and I hope I'm not speaking out of line, women are just more in tune with their emotions. It doesn't necessarily mean that they're more emotional. It's just that I do think women have a innate understanding of their emotions at that time. And yes, emotions for men and women could swing super hard, super left, super, emotional either direction. I just think that there's this thing in society where when women in particular say, I'm in a lot of pain, it gets written off. I know that the fact that you were young also is a factor, I think. And I think that it's scary. I mean, it's actually scary what you had to endure. So this started when you were 16. And when did you get your hysterectomy?
I was 23. And I'm 25 now.
So I'm not good at math, but it sounds like that was many years of you in chronic pain, having to deal with this because it took you finding a doctor to finally listen to you to get the job done, which is really, really scary. And,
I mean,
yeah.
considering I had my period starting from 11, by the time I got any of this taken care of, pretty much half my life I'd been dealing with problems. So I had to deal with a lot of pain and frustration, and
Right.
it's insane what I went through. I'm just
Yeah.
grateful that I'm over it now.
You're through
But
it now.
it,
Yeah.
it still is also frustrating, and a lot of times in the back of my mind too, because there's so many other women who are struggling.
Yes.
I highly recommend anybody, if they're interested in about medical bias. There was a segment that John Oliver did about 2 years ago, in 2019. I believe it was called Medical Bias, and it talked about the struggles that women and people of color go through when they go to the doctor's office and trying to be heard. Like women are 7 times more likely to be misdiagnosed and sent home than men. Majority of textbooks are geared towards men's bodies. They feel that women are just hormonal men, and so there's no way that their bodies are different, that they're going to react to things differently.
Right.
They even talked about a study that was done in the 90s, for uterine cancer, and every single person in that study was a man.
Wait, what? They don't have a uterus?
Exactly.
Okay, well, this was an actual
This is an
medical
actual study
actual.
that, yeah,
All right.
it came out in the medical journal. Yeah.
And here's the thing, because I wanna take some points here, because you guys know I like to be as objective as possible, but everything that Wiki is saying, it is true. And I hope that like Sammy is saying that their cousin was saying that they had a similar experience, but because their husband said something, that it became something that the doctors took note of. And I think there's also a misconception. Women deal with pain, not all women, but many women deal with pain from their period every month for their entire young adult lives. So the fact that anyone could even misconstrue that women are weaker or are not good with pain, it makes no sense. So it almost feels like doctors and healthcare professionals should take women's complaints more seriously, because we are so attuned with our bodies. We have to know what our bodies are doing. And honestly, I feel like we do experience it. I mean, PMS or PMDD, these are real things that women have to go through that are incredibly painful. I mean, it's just very interesting that when you say there's obviously medical bias, but then when you go even the further step and you say that there was a study done where they use men to study uterine cancer, I mean, it sort of starts to boggle the mind. But conversely, I do believe that, like, you never, whether you're a woman or a man, you don't want to make a permanent decision that might be irreversible if there are options. But in Weeky's position, there was no other option that would have worked for her. So I think that's a really important point to make as well. So, like, there's the duality that we're dealing with here of, like, there's medical bias and there's doctors who are not listening, but also on the flip side, you don't want doctors, removing your leg because you banged your knee. You don't want things that are super overreactive too. But I do feel like you should not have had to endure that for even a month. Your doctor should have been actively trying to help you figure this out. You should not have endured years until you finally had one doctor listen to you and do the right thing by you. No one should have to be in chronic pain for years until somebody listens to you. Do you feel like, now looking back at it, was there anything that was like that you go back and you say, I wish I would have done differently? Or was this like a completely just like the doctors completely just fucked up?
Yeah, it was definitely on the doctors 100% because I tried every argument I could think of.
Yeah.
I even would go in, I would have a list of all of my symptoms. I would have a list of my arguments as to why I need to have this procedure done. And they still ignored me. And they were like, well, you're so young. And they just came up with like, well, you're going to change your mind. And oh, it'll get better. It's happening now. It won't last forever. I'm like, this is like half my life. It's been lasting forever. It's not going to get better. It's been getting increasingly worse. And it wasn't until I was nonstop bleeding constantly that they were finally like, oh yeah, we need to do something about that because otherwise you might eventually become anemic.
I mean, even more than that, I mean, I'm so glad this didn't happen to you, but there are cases where women who, if you bleed, you're basically, that area is susceptible to more infection when you are having your period and you're bleeding. So you could have gotten very ill. And it's so frustrating that not only did the thing that gets me upset is that it's not like you weren't taking their advice. You said like 4 or 5 different birth controls, which, by the way, birth controls can fuck you up. I mean, they can make you really, really sick. They can make you gain weight. They can make your hair fall out. They can make you have, depression. They can make you, some birth controls are even, the higher the hormones. I mean, they can make you become suicidal. They can make you, they can alter your entire personality. I mean, you can have blood clots. I mean, these things are super serious. And you also did one of the most painful kind of birth controls, which is also an IUD. Which, by the way, if you had those polyps in your uterus when they inserted the IUD, they would have seen it. And that IUD could have ruptured one of the polyps in your uterus. So they got away with a lot of shit. I mean, they dodged a lot of bullets because you went through the ringer. You really did. I mean,
they looked with a scope before they put the IUD in and claimed that they didn't see anything. But every time I had any of these procedures done, they kept claiming, oh, we don't see anything. But it wasn't until I had it dissected after it was removed that, oh, yeah, there were things in there that are seriously problematic and life-threatening.
I can't even, and it scares me because I don't think that necessarily emotion should be something that skews results. I think in some ways it should be like, wow, this young woman who's endured chronic pain for years is saying my pain threshold is at an 11. Maybe that person who's taking morphine at 16 from the doctor's like fucking, it's nothing, like it's an Advil, and then fentanyl, which is literally, like insane, is the only thing that gives you any relief. You're telling me that person is, their emotions are getting in the way, or, oh, you'll get over it, or, oh, it's just women things. Give me a break. And I'm sorry that I'm getting emotional about this, but it frustrates me because no woman should have to not be listened to. No woman should have to go through How many doctors do you think you went through before you finally went to the Stanford doctor?
Oh God, I don't know. I can't count the amount of doctors on both my hands, how
Wow.
many I
So
went to.
possibly
Um,
over 10 doctors all failed you.
yeah,
And you had to endure years of that pain and bleeding. I mean, you could have become so anemic that you couldn't function. You know, anemia is no joke. I mean, obviously, many women who menstruate go through anemia because you're actively bleeding, and people who are heavy bleeders unfortunately can suffer from anemia. You are very lucky that you didn't get the severe anemia that affects your blood count to the point where you can have, your platelet levels can be so low that if you get a serious injury, you might not coagulate. You could bleed to death quickly. I mean, there's so many. You could be somebody who gets so anemic that you can't drive anymore because you could faint. You could get lightheaded. I mean, it sucks beyond belief that you had to endure all that. And I feel like in so many ways, the doctors who failed you got very lucky that you were such a strong, resilient person, because you could have had a different outcome and they would have been at fault for that outcome.
hmm
And, I'm very glad that that doctor at Stanford finally listened to you. And I'm so happy now. So you feel good. This has been 2 years and you feel
yes.
good and absolutely no regrets because you
Nope.
did what was right for your body. And do you feel like moving forward, now you can be an advocate, like coming on here and sharing your experience, that you can now say, like, maybe you're not alone?
Oh, for sure. And that was a big reason why I wanted to come on here and talk about it, because I don't think my case is normal just because I don't hear a lot of cases like it. But just for anybody who might be experiencing something similar, is that you're not the only person who's having to deal with this, and especially as a woman. And it's frustrating that you have to, at a point, take a man with you for them to finally listen, which is like, that shouldn't be okay,
Yeah.
because for one, they're not experiencing what I'm experiencing. This is my
Right.
own body. I
Right.
know what I'm talking about. I know what I'm experiencing, and I should be listened to.
Right. You
Um,
shouldn't, honestly, and
yeah,
I think this goes beyond. I think that whether you're young or you're a woman or you're a person of color, your healthcare provider should be somebody who is on your team. They're supposed to be the person who's fighting for you, not against you, where you feel like you're fighting for tooth and nail to be listened to have tests run. And it's something that becomes a serious issue when you're dealing with something like cancer, which some cancers are very fast growing and you need things done immediately. You need tests done, you need radiation, you need things done immediately. You have to be listened to because lives are at stake. And that's why I do believe, doctors, nurses, physicians assistants, they are supposed to be advocates, and many of them are. But unfortunately, the way that healthcare runs here, it kind of runs like a business when it's really not a business. You're dealing with people's lives and people's health, and no one should profit off of people's sickness. And I wonder if in this country in particular, if people didn't profit off of people's sickness, if maybe like our food quality would be better. I mean, the food in England and in Europe, they have half the ingredients. They don't use these dyes and things like that. I think there are so many things that happen here that are allowed. Your medical bill was $198,000. If you didn't have health insurance, you would have probably would you have been able to get an elective surgery for $198,000?
oh, absolutely not. No, I'd
Right.
be swimming in medical debt right now if it
Right.
wasn't for the fact that it was covered by insurance.
And then you're
I
crippled
mean,
in a different way. You know what I mean? Like
yeah,
then you have this debt looming over you forever. Um which is
yeah.
scary too.
And exactly. And that's why
Mm-hmm.
I'm very grateful that for my entire life,
Mm-hmm.
I've had such good medical coverage where
Mm-hmm.
I'm able to go to the doctor, because I know a lot of people can't. Because when I was under a Kaiser, my doctor's appointments were $15, and my any scans, any tests, any blood work, whatever I got done, it didn't cost anything. Um,
Mm-hmm.
and any medications I got, like the birth control was all free, but any other generic pain meds, it was like $5 for a prescription.
Right.
Um,
Which is
And
actually really good because some,
yeah,
are thousands. But now, do you still have the insurance, the Blue Anthem?
I still have the Blue Anthem insurance.
Nice.
I haven't gone to the doctor since I had my hysterectomy because I haven't had any issues. Um,
That's great.
yeah.
That is amazing. And Sammy was saying that they wanted to get an MRI forever and that they needed to bring their dad, and then they immediately approved them for the MRI once they brought their dad. And that makes no sense to me because Sammy is an adult, and if you are an adult, I understand when you're a minor needing a parental consent because obviously, you don't want anyone taking advantage of a child or someone who's under the age who may not understand what's happening to them. But when you are an adult, there is no reason you should have to have a parent, a husband, or anyone advocate for you other than for yourself. And I completely agree that sometimes if your partner is somebody who their doctor, and I'm not going to exclude this to just women, if you are somebody or your partner or your child is not being listened to, sometimes it does take them having to go through it too. Like Pretty Wicked Play said, it's sometimes someone else has to go through it to understand what you're going through. And I feel like that's not fair either. You shouldn't have to, your father or your brother or your boyfriend or your husband shouldn't have to go through the rigmarole that women go through to then understand what we go through. It should be that we all get the same kind of care, regardless of who we are, what we are, or what anything. The only thing that I do think minors should have, parental consent for major things. I think, how do you feel about when you went to the gynecologist when you were young? Was your mom part of that conversation? Did she go to the doctors with you and kind of thing like that?
Oh yeah, every time I went to the doctor, other than as I was an adult, she didn't go with me to every appointment after
Right.
that. But yeah, when I was a kid, she was always there with me.
Mm-hmm.
Of course, they would always have to have her initially not be in the room and ask
Right.
for consent of like, are you allowing your parent
Which
to
I
be
love
in
that
the
they
room
do.
and everything?
Yes.
Yeah.
Yes.
And I would always say yes, and then they would immediately call my mother in and let her be in there and
Mm-hmm.
part of the process because she was trying to be an advocate for me. The problem is that just statistically, women are not believed, they're not listened to. If you're not
Mm-hmm.
bringing a man with you, if you're not bringing your dad or your boyfriend or your husband, they're
Right.
not going to listen to you, which is
Mm-hmm.
just really shitty because he's a man. I'm a
Right.
woman.
And
There's a
they
difference
don't
between our
understand anything.
functions.
Yeah, they don't even understand the function. So it makes even less sense that they would need to have them advocate for you. It makes no sense at all. And yes, inhalers cost $100. I know that insulin in this country is thousands of dollars. And this is something that people will die without. I mean, inhalers and insulin, these are important things that humans need, and they should not be withheld because you cannot afford it, or withheld because, the doctor doesn't deem you need it, or that you're like, hey, I want to be checked for this. Can I be checked for this? And the doctor's like, you're young, you don't need it. Or you're a woman, it's just women things. That sort of antiquated thinking should be gone from our healthcares. And we need to kind of, in some ways, I would love to be able to go back to when my dad first became a doctor, because, just a small little segment, I wanted to be a doctor. I was on my way to going to medical school, and I didn't, obviously. But the thing is that I wanted to be a doctor like my dad was a doctor. And my father sat me down, and I was in interviews for medical school, and he said, Haley, you will make a great doctor, but it will suck the life out of you. He said, you're not going to get to be the doctor who gets to hug their patients and spend time with every patient and get to be there. You are not going to be able to do that. They're not going to let you do that. They are going to want you to see as many patients a day as you can, to do as many procedures as you can, as thoroughly as you can, but as fast as you can. And that is not what you want. And I was like, no, Dad, I wanted to. I was still sure of myself. But honestly, after really, he told me over and over, he's like, it will suck the joy out of you because you're not going to get to do what you want. And it's true. I wanted to be the doctor like you had at Stanford, who listened to you and talked to you and, was there for you. But you saw how many doctors before you saw her, and it's heartbreaking, and it's not fair. And I'm like, first of all, I just want to say I'm really honored that you shared this story with us. I'm really appreciative that you wanted to share this with us and to tell your story that I hope if anyone else is listening to will know that they're not alone, and that what you endured, which was a very severe case, but it can be applied to so many of us, you know, so many women, so many people of color. It can be applied to us as well. Is there anything you want to share with us, Wiki?
No, other than I'm grateful that you had me on today. I appreciate that and sharing my story. And I hope that I can help somebody in their journey and trying to figure out what's going on with them, and hopefully they can try and advocate for themselves in the future. I definitely think that bias training is a super important problem issue that needs to be resolved within the medical industry. But I wish we could fix that in a day, but it's going to take time.
It's going to take time. And what you did today was brave and incredible, but also it's just a testament of who you are as a person, because you already endured what very few people go through in a lifetime, and you endured it at such a young age. And I think that we all as a community obviously adore you, but we also can see where that strength and resiliency comes from. And I'm so honored to be your friend. I'm so honored that you shared your story with us. And you're fucking badass, man. You're such a badass. I cannot believe it's been an hour, but it has. And I just want to say thank you so much again, Wiki, for joining me on episode 9 of Coven Conversations. You are a phenomenal human being. And thank you, everybody, for listening in on Coven Conversations episode 9. I'm PoopWitchX. This was WheekyPotato. And hopefully we'll see you next time. Bye, guys.